Hello, everyone. I wanted to welcome you to our second episode of our podcast. My name is Josiah Wink, and today I'm here with Stephanie Stout to discuss harm reduction. This is one of our second podcast. This is our second podcast ahead of our event on November 14th. This event will be taking in the Bird Health Science Center in Martinsburg, and our event is How is West Virginia putting West Virginia first? So today I'm here to talk with Stephanie. Stephanie is the Berkeley County Recovery Resource Center coordinator. Hi, Stephanie.
Hi, Josiah.
How are you today?
I'm doing all right.
Okay, so I have some questions for you. So the first one is pretty simple, I think. It is, who are you and what do you do?
Is it simple though? My name is Stephanie Stout. I'm a person in long-term recovery. I also serve as the Recovery Services Coordinator here at the Recovery Resource Center and the Program Administrator for the Berkeley Morgan County Harm Reduction Program. And I am the founder of Plugged Inc., a local nonprofit that helps remove barriers and increase workforce training for people that are in recovery and reentering from incarceration.
That's amazing. All right, so Stephanie, how does the work you do assist those suffering from substance use disorder and the families impacted within our community?
So it's really multifaceted. When we look at the Recovery Resource Center, that's for anybody that's coming in from the general public, wanting or seeking help or education, information, and their families and friends. We offer various support groups and fellowship groups such as AA and NA. We have a specific family support group for individuals that have loved ones or friends that it somehow affected them with their substance use. And then, of course, there's the harm reduction program, which really encourages safe ways to continue drug use with the hopes that we can improve wellness for each person, because we can't make people stop using drugs, but we can encourage safer ways to do it.
What are some barriers that you've noticed that people may face in accessing harm reduction or just generally in the community?
Transportation is a barrier, excuse me, across the board, whether it's for trying to get to harm reduction, trying to get to your provider's office, trying to get to inpatient treatment, and trying to get to employment. That's like the number one thing. And it's not just here in the Panhandle, it's across the state. Continuously in work groups, that's what I hear over and over again: transportation, transportation. And then there's also getting our required documents to be able to receive care, whether that's health insurance, identification to be able to get health insurance, whatever that may be.
Yeah, those sound like some really important issues, and I'm glad you brought them up. So something that I notice a lot, because I also work in harm reduction. I volunteered at a clinic. One of the things that I noticed is that a lot of people who aren't familiar with what harm reduction is think that it really enables drug use, and that it's just giving people like open access to things, and that it does more harm than good. What would you really say to counter this narrative?
Well, when we're looking on a micro level, as far as enabling, it is enabling people to somehow reduce harm to themselves through their drug use, enabling them to connect with resources and education, various testing such as HIV, hepatitis C, family planning, getting linked up with insurance so that they can receive the health care that they need. And, when we talk about on a macro level, people like to see numbers. The cost of harm reduction programs are fairly affordable. When you look at the cost of treatment for one person for HIV in comparison, it's insurmountable. So really, these programs help to prevent that from happening, but also to assist people with them finding out that maybe there's a safer way to do things so that that doesn't have to be something that, they find out, their test is positive.
Mm-hmm. It's a really good point. We've seen the impact that the war on drugs had on the country, and it's not going to go away any soon. Fentanyl and xylazine are also big issues. Um, so I'm curious what you think is a good course of action or the best course of action moving forward in dealing with the opioid epidemic.
Well, the number one thing we can do is ensure that our communities are flooded with naloxone or Narcan. That is a number one preventative method to reduce overdose deaths. And we have, since, making this something that's readily available, seen a tremendous decrease in overdose deaths, not only across, West Virginia, but when we look at like the statistical analysis of what it looked like in 2017 in comparison to now, we've decreased as a state, but in our county, 29% decrease in overdose deaths. So the numbers are there to make the point and prove. I would say that the other key thing is having more access to the resources, things such as harm reduction, drop-in centers, such as the Recovery Resource Center, and educating the community on stigma and what it looks like, and how a lot of times a little extra support in treating someone as a human can go a long way.
Yeah, yeah. Um, within the community, I want to say, have you noticed that there's like been a lessened stigma in the past few years?
Absolutely. Absolutely. When we talk specifically about harm reduction and what it looks like in the beginning, because I was there for that, a lot of pushback from our law enforcement and even, just other prominent individuals within the community. And after educating and, sharing the value, and, unfortunately, after having to show a couple faces and names of, hey, do you remember this person, and look at them now, because although you might have a participant attending, they can improve the way that they're living through the program and through learning new things. And not everybody who uses drugs is somebody that's homeless or doesn't have employment. We see a lot of people that they are they're able to be functional drug users, and sometimes that's a realistic thing that we see. And so stigma in the way that it's conceived as far as harm reduction has definitely decreased. And looking at like recovery and substance use within like the panhandle, it's a tremendous decrease, and that's through advocacy and people speaking up that are in recovery and sharing their stories. For me, that was a big thing. I know that whenever I shared that in Jefferson County, my arresting officer was over there, and he uses my stories to tell his other officers about how people can change, how people can recover, and they can make a difference in their community. And just because those choices happened around your past doesn't mean they have to define you and where you're at today in your life. And I think that that's really changed the narrative on how a lot of people view it. Now, there are still the naysayers and the people that are against Narcan and all that stuff, and sometimes I just have to let them be and just keep doing the work I'm doing, because I know that it's making a difference.
Yeah. So I know some people don't understand what Narcan is. Would you, if there's any like misconceptions that you know of, would you mind maybe explaining them for the audience at home?
Sure. So Narcan absolutely only works for opioids or opiates. It is a nasal spray. It is not a nasal spray that you use to clear out your sinuses or to give you a boost of energy. It is solely for the purpose of opioid or opiate overdose reversal. So what it does, this is your opioid receptor. This is the opiate or opioid. When you administer Narcan, which is a very short, quick spray up your nasal, area, it breaks that off the receptor. And so it's able to restore breathing, getting oxygen to the brain. And through that, somebody can live. Now, of course, it's not long lasting. So it's anywhere from 30 minutes to 90 minutes. We always suggest calling 911, having somebody go into a medical facility so they can be monitored, make sure that they don't overdose again, because after that 30 to 90 minutes, they can. It's safe on children, safe on animals. It's, a lot of people think it's just for people who use drugs, illegal substances. Our aging population, the elderly, like 65 and above, they're an extreme risk of overdose because of the way their organs are functioning and slowing down as they age. We don't think a lot about children, but they get into things. If there's pill bottles around, they're at risk. And the same thing for animals, because I don't know about you guys, but I've had a couple dogs that have chewed up like couches. So I'm sure they could get a pill bottle open.
Yeah, so wrapping things up a little bit, I have two more questions for you. The first one is, if people want to get involved in harm reduction in their local community, or they want to help out more, how would you recommend that they could do that?
So if you're in this community, you can just reach out to me. You can find my information at the Recovery Resource Center's website. If you're in a community that's not necessarily in this area, I would reach out to your local health departments. That would be the first stop. Look at what maybe your state's laws and stipulations are on harm reduction. We do have a lot of restrictions here in West Virginia. So we do the best that we can with those restrictions. And like looking over into Maryland, they're less restrictive. They're more open to a lot of other things that we can do to help people reduce harm other than just the supplies that we give.
Thank you.
You're welcome.
And finally, do you have any thoughts about how West Virginia First Foundation should allocate funds towards the opioid epidemic?
Oh, absolutely. This money was made off the backs of people that are unfortunately mostly dead and gone. It should be going back into preventing that. It should be going back into recovery services that are offering treatment, inpatient, outpatient, assisting people that don't necessarily meet the guidelines to be on Medicaid, but definitely need treatment and they can't afford health insurance. Like the barriers that we see is what it should be used for, not for police or drug enforcement. There's money out there for that. I would love to see it going back into programs that are helping people deter from dying, getting the treatment that they need, and being able to actually find it.
All right. I appreciate your answer, Stephanie. It was really nice talking to you. For the listeners back home, I just wanted to reiterate that this is one of our podcasts ahead of our event on the 14th of November, and this event will be taking place at the Bird Health Science Center in Martinsburg, and it is How is West Virginia First, putting West Virginia first. All right. Thank you everyone for stopping in to listen, and I hope you have a wonderful day.
Thank you.